Meenakshi Bajaj.
At the outset, I'm truly grateful to Dr. Mohan and his team, and thank you so very much for the warm introduction, Sudha ma'am. Today, I'm going to be talking to you a little different from the usual talk. So I'll be emphasizing more on how we can beat the blues with diet and diabetes. I think it's a known fact by any layman that when we are going for an exam, going for an interview, we say we have butterflies in the stomach. So it very well clearly tells us that there is some gut-brain connection. And it's not new for this audience, I'm not talking rocket science, that there is some connection. So what is this connection, and can we address this connection to help address the blues in diabetes? So when we talk of diabetes and metabolic health, diabetes and mental health, they are all bidirectional. So when I say bidirectional, it's sad to know that anybody who is a PWD, a person with diabetes, it is she or he is at high risk of developing depression by 2 to 3 times higher risk, and anxiety and diabetes distress. So one side we are having a PWD who is having a high risk of developing depression, anxiety and diabetes distress. On the other hand, somebody with anxiety, depression or diabetes distress is equally 2 times at high risk of developing diabetes. So this is the bidirectional relationship which they carry. And unfortunately, look at the percentage. 20% more chances of anxiety than people without diabetes. 33 to 50% of PWDs experience diabetes distress in any random 18-month period. I would want to share a small example over this, a true time example. Last week, one of my PhD scholars, she is due to submit her thesis in the next 10 days. And she had her OGTT positive. Her blood sugars were skyrocketing 200 plus. So definitely she knew she had to go on insulin. But thankfully it was the OGTT which was 200 plus. Her fasting was 95. So we knew surely, okay, maybe a small dose of insulin is going to go in. So don't worry too much about it. So we just pulled up her recall. And what did we understand? That for the past 7 months, she has been consuming tender coconut water on daily basis because the first trimester of her pregnancy was such a ruckus. She couldn't tolerate anything because of her morning sickness. And that continued for the past 7 months. And something stuck up, and her mother-in-law insisted that she has a red banana every day at bedtime. So we were like 95 plus the blood sugar is fasting. So probably if we cut the banana, maybe that may make a difference. Probably if we split the meal, maybe that may make a difference. And today, meaning just less than 3 days, she had to go back to the dietologist with a fasting and postprandial. Only then they can start insulin or medical nutrition therapy. So, but we started in the department early itself. In less than 3 days, just knocking off the banana, knocking off the tender coconut water, splitting all the 3 meals, she does not even require to, think of or worry of it. So similarly, I have several examples to tell us that how one can walk into anxiety, diabetes distress, and further depression. We had a young child, a 16-year-old child who had been admitted for vomiting and abdominal pain. Obviously, as a dietitian, and when talking in a diabetes conference, it has to be type 1 diabetes. In less than a week's time, he had his board exams. So you can imagine each one, whether it's a young or an adult or an elderly, each one has their own challenges in their life. Apart from that, if we have a new challenge of diabetes walking in, and when it is long term, it definitely leads to depression. So there are several scales with which you can assess and find out whether the patient is having mild, moderate, or severe depression. But are we in a situation where we want to assess the patient for scales to identify whether they are mild, moderate, or severely depressed? I think we should talk of well-being. Several years ago, about 25 years ago, when I started my practice, when I used to talk to patients, I tell them, don't eat this, don't eat that, don't eat this. I started my conversation with don't, and don't. And the PG did make a mention to me and said, Madam, why are you so negative? Why do you start with saying don't? Why don't you start saying that, madam, include a handful of nuts or a handful of beans or a handful of whole grams, choose on whole grains instead of saying, don't have appam, idiyappam puttu, don't have porridges, don't have juices. Why are you so negative? Be more positive in life. So when I'm saying here, looking at the scales to assess and see mild, moderate, severe depression, why don't we see the well-being scale? So we look at the well-being scale, that will also give us the information on depression. So this was yet another publication recently in the Harvard Gazette in April 2025, which told us there are 17 daily lifestyle factors which are responsible for late age depression. So this is not new. I think Cheryl has already spoken about certain of these factors, but understanding here is each factor begets the other factor. If you are overweight, if you are not maintaining sleep hygiene, if you are not having a great physical activity as part of your daily life, it is going to beget pre-diabetes, diabetes associated complications, the list is going to go on. So among these 17 factors, the two which top the list with reference to depression is CKD and hypertension. But we also know CKD and hypertension go hand in hand with diabetes and their complications. Another sad news here is we see that depression is more in women than in men. That is really sad to know, but I wouldn't be happy to say that men are not depressed, but it's sad to know that there are 2 times more risk of depression. Now, what are the factors here importantly with reference to women are lifestyle factors, genetic risk. Most importantly, I'm going to be addressing the next 12 to 13 minutes on gut microbiota, gut-brain axis. So this is what was yet another new term which I heard last week by Dr. Usha Sriram ma'am. When we had a talk on Menopause Society, she did mention the term inflammaging. So it tells us that as one ages, immaterial whether you're a male or a female, you are having inflammaging. That is one point. And second point is those who attain menopause, there are 2 times higher risk of inflammaging. There are 2 to 3 times higher risk of metabolic syndrome. So there again we know that they are also at high risk. Those who are at menopause are 2 to 3 times higher risk of moderate to severe depression. I think Cheryl has spoken in detail about the anti-inflammatory diet, so I don't need to go into the details. But definitely I would want to make a mention here is a pro-inflammatory dietary pattern, which could be either the method of cooking. I think there's a wonderful paper by Dr. Mohan et al. And Dr. Shobna et al. The paper on dietary age, which Cheryl was making a mention, that is when you are frying, roasting, baking, they are going to increase the dietary age. So when you increase the dietary age, you are setting in inflammation. Low-grade inflammation is going to land up with insulin resistance on one end, on the other hand, depression. So low-grade chronic inflammation has been linked to alterations in neurotransmitters and is associated with an increased risk of depression in adults. I think there has been a big row fight the last 10-15 days on the samosa jalebi going on. We need to understand that what is the problem with samosa, jalebi and donut. So if I am to talk samosa, obviously all of us know it's the maida on the outside and the potato on the inside. So what is the problem with the maida here is the streptozotocin, which is the chemical which damages the pancreatic beta cells, and obviously you know what will happen if you damage the pancreatic beta cells. Second thing is you are frying, so you are increasing the dietary age. With reference to donut, once again it's the maida inside and you are baking. So baking is again dietary age, and not only that, the jalebi is going to be soaked in sugar syrup, and the worst on all the lot is reheated oil, which is going to increase trans fats, which is once again inflammatory in nature, which causes gut dysbiosis. Now, gut dysbiosis also had a direct relationship, bidirectional relationship with mental health, with inflammation. So this is a wonderful slide. For this one slide itself, I need 1 hour, and I have only 10 minutes to go, so I'll not delve too much into this. But this is one of the most important slides of life for life, because when your gut is dysbiosed, entire head to toe you're in trouble, whether it's fatty liver, whether it's pancreatic inflammation, whether it's AKI, renal calculi, atherosclerosis, dementia, stroke, depression, or metabolic health. So how do you intervene depression with the help of diet? At 3 levels. at the mitochondria level. So when you're working at the mitochondria level, you're reducing the reactive oxygen species. Second is at the genetics level. At genetics level, if somebody is at high risk of diabetes with both the parents, grandparents, so we know we can still prevent diabetes, right? So how do we prevent it? By lifestyle. Lifestyle modification, which will keep the inflammatory gene dormant and not express it. Last but not the least is the short chain fatty acid, which I'll delve a little later. So Shilpa is going to be talking to you about plant-based and animal-based. I'm not going to delve on it. This is Manjalika. I'm sure so many of you would have heard that one actress, recent Bollywood actress, was found to lose a lot of weight, saying she came to Chennai and followed an anti-inflammatory diet. So what is an anti-inflammatory diet? I don't delve into it because Cheryl has spoken on it, but I would like to say the 5 R's. 5 R's to improve your gut health. First R is remove. What are you going to remove? The stressors, the triggers which cause chronic low-grade inflammation. Second is replace this with a healthy anti-inflammatory diet. Third is re-inoculate. This is the most important crux. Prebiotic, probiotic, symbiotic, postbiotic, and psychobiotic. So I'll come to it a little later. And repair it. You cannot do without repairing the gut, because whenever there is gut dysbiosis, during COVID time you would have heard cytokine storm, a leaky gut. You would have heard all of these terms. So it tells us that your gut is leaky, which needs to be repaired with vitamin A, C, E, zinc, selenium. Last but not the least is you reach eubiosis. How do you reach eubiosis? With all these biotics and plant-based diets. Now psychobiotics, which we say are present in oats, barley, kefir, kimchi, fermented foods, yogurt, but unsweetened yogurt and with plenty of strains. But I would say instead of running behind probiotic, because each capsule or each drink will have only a limited strain, and evidence tells us that each strain has a different function. X strain will work on a diabetic foot infection. One particular strain will work on GDM, one will work on type 1 DM. So each strain has a different role to play. Instead of running behind a probiotic, choose a prebiotic which will help synthesize a probiotic in abundance. And psychobiotics are those lactobacillus. You have the lactobacillus bifidobacterium. These two in different strains. You have the plantarum, helveticum. You have the rhizomus. I think I'm making a mistake in that. Then you have, as I mentioned, you have the psychobiotics. Then this is yet another interesting slide which tells us that scientists have found that brain can directly sense the gut bacteria in real time using special cells called neuropods. They are present in the colon as well as the small intestine. What do? They detect a bacterial protein called flagellin and respond by releasing PYY in short span, less than few seconds, which in turn releases leptin and helps to provide you satiety. This is instant. So it works in 4 ways. The 4 ways are the neural pathway, you have the endocrine pathway, the immune pathway, and the microbial metabolites. Now why is this slide suddenly coming up for no reason? This is the prebiotic which I have been talking to you of. It also has a role to play in the form of a second meal effect. It's a lente carb which blunts the postprandial response. So if you've taken a barley-based meal for breakfast or an oat-based meal, but oat has to be either rolled oats or steel-cut oats, not the instant oats, and not in the form of a porridge. Or you take a chila made out of a lot of dals or a peseret or an ade. When you take that in the morning, it's going to have a second meal effect, but most importantly, it has a prebiotic effect which helps to synthesize probiotics. So what does this prebiotic soluble fiber do? Does not get digested, gets fermented in the colon to produce short chain fatty acids. These short chain fatty acids will further stimulate the L cells to produce further the satiety hormones. So how do they work? They release the GLP-1 and they release the leptin, which is the satiety hormone. They work on 5 levels. That is, in the lipid, it works on the liver, it works by reducing the lipid accumulation. Pancreas stimulates insulin secretion. In the adipose tissue, it increases leptin, which is a satiety hormone. In the muscle, it increases insulin sensitivity. In the intestine, it increases intestinal gluconeogenesis. So this is how the prebiotic, that is the fiber in your diet, works. And unless there is fiber in your gut, the neuropod is not going to give the information and you're not going to be satiated. Eat to beat depression and anxiety. So along with this prebiotic, which is the fiber, you need to choose on folic acid, B12, B6, omega-3 fatty acids, zinc, selenium in order to improve depression. This is yet another important message which tells us that first the fiber, then the protein, and then the carb. And we have a study which tells us that carb at the end is best than in combination as an entire meal. Last but not the least would be the role and significance of dietary protein, which tells us that it has a thermogenic effect, it has a satiety effect, insulinotropic effect, as well as an insulin sensitizing effect. So that's why there are several papers talking to us about handful of nuts or egg whites or lean protein or a raita or a sundal just before your meal, which will give you this insulinotropic satiety and thermogenic effect and helping in blood glucose control. This is yet another interesting slide of mine which I love talking on. We talk about fruit, right? All my plate, Jocelyn's my plate, ADA plate, ICMR plate. Always when you look at the plate, it talks of the fruit along the plate. Never suggest a fruit along the plate, along your meal. For a PWD, it's always in between the meal. Obviously, you need to look at the sugars. You need to look at whether the patient is having an elective surgery. All those reasons have to be cleared. Only then you give the clearance for fruits. In fruits, if you consume it with nuts, with seeds, squeeze some lime, a pinch of cinnamon powder, and a vegetable. It does wonders. Like you want to consume mango, you cannot stop with one slice. So that one slice of mango, add nuts, add sesame seeds, squeeze some lime, finely chop some cucumber, tomato, and the nuts could be the healthier nuts like almonds or walnuts. In those where the LDL cholesterol is not a worry, then very few dash of groundnuts or a pineapple with a capsicum. These are not just recipes just told to you just like that. We have tested these recipes, they taste amazing. So that also gives you that you've actually consumed the fruit but not raised your postprandial peak. And last but not the least is the method of cooking which I mentioned to you. This is a wonderful paper by Dr. Shobna ma'am and Dr. Mohan et al. Which talks to us about the methods of cooking where we say deep frying, shallow frying, roasting, baking, grilling are not so great in terms of dietary age. But this was extrapolated by a beautiful understanding which I had. I read a paper which said sweet potato, when it is boiled, baked or roasted, look at the GI. When it was boiled, the GI was 41. When it was baked, 51. When it was roasted, 82. So this can be, this information what Dr. Shobna ma'am and Dr. Mohan sir has studied can be extrapolated to several foods to understand that when the dietary age comes down, chronic inflammation comes down, gut dysbiosis comes down, and ultimately not only you're achieving good glycemic control, you're also achieving the challenge to prevent depression. Last but not the least would be whatever I may eat. Even if I may eat a handful of nuts, which are low GI, low GL, healthy, omega-3, and protein, plant-based protein, if I'm going to eat it late in the night, I'm going to actually affect my metabolic health. So chrononutrition is yet another important aspect. So try and eat as early as 7 p.m. like our ancestors. Remember yet another thing, as we know that our PWDs gradually over long term walk into nephropathy. If the patient is having hyperkalemia, hyperphosphatemia, raising urea creatinine, you cannot be pushing greens at libidum without leaching them. You cannot be pushing too much of protein in the form of fish or nuts. You'll have to do a restriction there. So this is a slide which tells us that. So that's 3 ham and cheese omelets, 1 order without the cheese, that's for the cow, 1 without the ham, that's for the pig, and another without the eggs, that's for the chicken. So as a dietitian, we have to tailor-made our diet. We cannot just use a single blanket prescription for all our subjects. I'm going to recommend you to start biting only vegetarians. So even though I'm a non-vegetarian, I'm trying to push myself to become a vegetarian to improve gut health, embrace health. Mental health is true wealth. So modification of diet may prove to be a helpful strategy for prevention and improvement of depression in PWDs. So go plant-based, low GL, because not all low GI are healthy, pre, pro, post, and psychobiotics. And apart from the dietary approaches, remember the non-dietary approaches. Think of the me day. Spend at least 1 day for yourself. And when you are very low, either few of us go shopping, few of us go eating, few of us go and chop our hair. So each one of us takes out our anxiety and distress in different forms. So ensure that whatever you're doing, it could be over a cup of filter coffee and a masala vada. With your friend, you're having a small discussion, or a cup of hot ginger tea with some pakoda and a little bit of discussion with my friend, which relieves my anxiety and stress. So choose on a me day. Sleep hygiene is important. And importantly, dopamine fasting or the digital detox does wonders. Spend little time on your hobbies. Don't forget to meditate. And this was a recent publication in July 2025, which tells us 7,000 steps is enough. 7,000 steps will do the job of reducing depression by 14% and diabetes by 22%. So food is not merely fuel for the body, it is nourishment for the mind. It is an emotion. We all bond with food. When we are happy, we want to eat. When we are sad, we want to eat. But choose on the right food so that you're not sad all your life. And I would just end this slide by saying that don't look at how to treat, look at how we can prevent. So choose on the well-being scale than being ready to assess the scale for moderately or severely depressed. Thank you for your patient listening.